What you just said is one of the most insanely idiotic things I have ever heard.
What kind of ignorant shit is that?
At no point in your rambling, incoherent response were you even close to anything that could be considered a rational thought.
You idiot, you fool!
Hey, dummy!
This is the Ignorance is Blessed podcast.
Everyone in this room is now dumber for having listened to
it. Hey, idiots! Welcome to Ignorance is Blessed, the podcast that attempts to overcome ignorance, mostly by asking ignorant questions, with me, Jessica Michelle Singleton, or JMS if you're lazy. I just bit my own tongue, stuttering on lazy. I'm a comedian. I can't talk, apparently, and I don't know a fucking thing about anything. That is why we're here. If you're new to the podcast, welcome. I am leaning in. I've learned how to Skype. This is my first Skype episode, so much more to come. I apologize if the quality is slightly lower because of the call, but I tried to do my best to give you the best quality we can. I think it sounds pretty good. Anyway, thanks for joining us. Looking forward to more content, more things that are available to us now that I've finally decided to learn virtual technology, which apparently has been pretty easy this whole time. Anyway, please subscribe if you haven't already. Give us a rating, a review. It helps other people find the podcast so more of us can learn answers to our ignorant questions. And thank you so much to all the new subscribers and reviewers. And big shout out to my best idiots forever, Gene and Kathy, on Patreon. That's right, I have a Patreon. That's why I'm not selling you shit on here. That is a bunch of garbage trying to make money because I am supported by viewers like you. I call you viewers because I imagine you staring at your phone, which does not have a video of me, just totally enthralled. What is she going to ask next? Who is this moron? Head over to patreon.com/ignoranceisblessed. All one word, no spaces, no hashtags. And you can get involved. I send postcards every month to some of my patrons. There's bonus content. I might have to get creative with these postcards, you guys. Usually I send from somewhere I've been, and I'm off the road for a while until further notice, I think. Although I do have a show scheduled May 9th in Anchorage, Alaska, if you're up there. Fingers crossed that maybe people listen to the rules and this thing cools down faster than they are anticipating it will. I doubt that will happen. But I've not canceled my ticket, and I am plugging forward with promoting that show because, frankly, I need something to look forward to. But yeah, there's going to be bonus episodes, and also I'm bringing back Google Hangs for the 25 and up patrons. I switched it up because of my schedule, and I offered something else. I'm going to continue offering, VIP tickets and stuff for when shows come back, but I realize that's not a feasible thing right now anyway, and let's connect. So you can spend an hour with me every month, just chatting, asking whatever you want, shooting the shit, and bonus content, like I said, postcards, might get creative, maybe some handcrafted cards. I'll talk to my patrons and see what we're thinking. So thank you to all of those people. Shout out to my brand new patrons, John Krug and Ashley Hines. John has been following for a long time listener, sends a lot of memes, posts in the Facebook group. If you guys are interested in getting involved more with the podcast, you don't have to be a patron to be in the Facebook group. It's Ignorance is #BlessedIdiots. Ask your ignorant questions. Maybe you have a perspective that you're like, a lot of people disagree with this, and you want to start a conversation. Safe space for unsafe questions. No name calling, just friendly discussions. Agreeing to disagree if we have to. But, and funny memes from people like John and Ashley Hines, all the way from Freiburg, Germany. Fucking cool. We are spreading like the coronavirus. Dear God. Speaking of which, that was not an intentional segue, but my guest this week is a physician's assistant in America in an emergency room. Amber Janson, she is a friend of mine, working her butt off right now in crazy times. So a lot of you guys sent questions in the Facebook group, and I asked some of my own, I asked yours, and she was very informative. It was a great interview. We kept it concise, it's not too long, but she answered a lot of questions and said that she's happy to come back if we want a follow-up episode. So you guys know where to find me. Facebook group's probably the easiest, but JMS Comedy all over the web. Let me know what you think. And other than that, no other shows to plug, obviously. I have a new series coming out on Instagram, IGTV, Quarantine Weekly with my friend Jeffrey Baldinger, who I am co-writing a musical with. So go over to Instagram.com/Quarantine Weekly. We're going to just do, it's very low budget. It's homemade videos. We are separate. The guests are separate. We're cutting to our friends who are a lot of hilarious comedians that you guys know and love. Just a way to make something, little extra thing for you to consume once a week, kind of giving you updates from around the web. And also on my other podcast, Name That Pod, that I co-host with the incredible Nicole Amy Schreiber, we're starting sort of a book club. We're going to read The Tipping Point and go chapter by chapter, breaking down what we've learned, what we think. And then after The Tipping Point is done, Nicole Amy Schreiber, who is I won't name her age because she's going to reveal that after her birthday this year, who has never read the Harry Potter books. We're going to go 2 chapters at a time, the whole series, reviewing Harry Potter from the perspective of her, someone who's never read it, and me, someone who is an absolute dork about it. Shout out to all of my, Hogwarts friends out there. And then at the end of each book, we're going to we're going to watch the movie and discuss the differences, talk about what we think. We'll be doing our regular scheduled chatting about nothing episodes, but that's an extra bonus thing. If you want to jump in, follow along. I just downloaded The Tipping Point so you can read along with us. And then, I don't know, maybe we'll do the artist's way after we get through Harry Potter. Who knows? The world is our oyster, and I am deathly allergic to shellfish. Here you go, Amber Janson.
Hey, idiots. I am here. Well, I'm on the phone because I can't be anywhere with my dear friend, Amber Janson. Thank you for joining me, Amber.
Yeah. Hi, guys.
So let's just dive into it. You are a physician's assistant in an emergency room.
Correct.
That is fucking crazy.
Yeah. It's really it's a scary time to be in an emergency room.
I mean, that is a crazy job in general. And then you pile on what's going on right now. I mean, well, let's talk about that, I guess. How has your job and interactions changed over the past few weeks?
Well, I mean, a lot of times healthcare in general it just feels like a regular job. I see people and I treat their problems. A lot of times it's not really that big of a deal. People come to the emergency room for everything and anything. And then, sometimes it is serious. And so sometimes I feel the weight of my job. But usually, I just go to work, I do my thing, I come home, and I really don't stress about it all that much.
You kind of leave it at work.
Except for occasionally, I have a patient here or there that will kind of stick with me. But in the last few weeks, everything has changed. So, I mean, just the stress of not knowing how to manage this. We don't know, as literally every single day, everything changes. The protocol for how we're supposed to deal with these patients change. We're learning more and more about the disease process and if we can treat it, and everything changes every single day. And so we've been scrambling to figure out protocols, and it's just a mess. We're starting to get it a little bit more ironed out now, so I'm feeling a little safer. But in the beginning, it was just we were basically just exposed to sort of everybody because we didn't know what we were doing.
Oh my God. Yeah, because you're just kind of flying by the seat of your pants. They're discovering so much day by day.
Yeah, exactly. And then, we're running out of ways to protect ourselves, and the CDC keeps changing their guidelines, and they're not really protecting us. And so we're feeling nervous about that. And it's just really stressful.
Really? Okay, so are you guys having what kind of supplies? Are you having supply scarcity?
Yes, we are incredibly scarce on basically everything. Masks have been the biggest thing. I've reached out to my friends and family. And
I know I saw that Instagram. You literally Instagram post. Does anyone know anyone?
Yeah, I mean, we're that desperate. We got to a point where we had 100 masks in the entire hospital, and they were rationing our masks. And they were giving us surgical masks as opposed to N95 masks. And we'd get one for a 10-hour shift, which just is not enough. So
you're supposed to switch them all the time, right?
Yeah, between every patient, And so I'd reached out to friends and family, and people have been really supportive and donated masks, which is amazing. So thank God. Yeah. So we have a lot more now, which is great. But it's been really stressful.
Wow. I mean, I can't even imagine. So would you say before the virus, are there a lot of people who come to the emergency room for things that you're like, this isn't an emergency?
Yeah, like my finger has been tingling for the last 3 months. Like, what can you do about it? Yeah, they just like the stupidest complaints in the world.
I mean, no shade thrown. I've been to an emergency room like 2 times and had them be like, this is gas, and been like, are you sure? Like, I'm that asshole.
It happens.
But I'm like, it's my kidney failing, and they're like, it's a fart trapped in your side, and I'm like, oh well, it sure does hurt. It's a good day. I called out of work for this. Wow. So
yeah. So, but you know what? People are really heeding the warning to stay home, and so we really haven't had any stupid complaints lately, which is amazing. We really appreciate it because things are really going to get crazy in the next few weeks, and we're just not going to have the time or the space to be dealing with stuff like that.
With the extra stuff, are you getting a lot of people coming in with like worried they might have it?
Yeah. I mean, and at this point, so in the beginning, it was a lot of people worried that they might have it. And now, as things have kind of progressed and now that there's more of like a community spread going on, we're getting people who actually do have it. Like a lot of people we can't test. And so it's really, I think it's really frustrating for a lot of people because they come in and they're like, I have all these symptoms. I'm like pretty sure I have it. And I'm like, yeah, I'm pretty sure you have it too, but I can't test you.
Is that what you guys have to do?
Yeah. So we just send them home.
Who gets tested? Because I feel like, how are celebrities getting all these tests?
Because they're just rich. I know. It's really
they just like pay a doctor to get directly to the like supply.
Yeah, exactly. And they're asymptomatic, like all these basketball players.
So they're wasting the tests.
Yeah.
Well, not wasting, I guess. Since some of them had it. I don't know.
Some of them had it. Yeah, I know. So it's confusing, and the public health department changes their criteria for when they test or when they want us to test all the time. So right now they've changed it again because we're running low.
Yeah.
And so at this point we're only testing people who are being admitted. So if they're like really, really, really sick, we're testing healthcare workers, and like EMTs.
So you guys
and
get
firemen.
tested.
We're allowed to get tested. Yeah.
Wow. I have a listener in the UK who asked about that because she said in the UK, the staff isn't allowed to get tested. That's like, they don't have enough tests.
Yeah, that just changed for us like 3 days ago. So we're like,
wow,
we're allowed to get tested now.
Because it was like this, just like either like stay home and let him be short staffed or just fucking suck it up and maybe be passing it on. And it's like, yeah, okay.
Yeah.
So yeah, like,
go ahead.
No, you go.
The criteria for us in quarantine is different. Like, so if we do have it or if we do have symptoms, we are only supposed to stay home for like a few days, basically. And then we can come back and I guess just spread it to everyone. I don't know. Like, it's a mess.
Just stay home for as long as you can't stand up and then
come back to work. Yeah. Yeah.
Come out here, cough on the patients. It's fine. No, it's obviously not like that, but
it's so contagious. It actually kind of is. It's so contagious too. And like, we're running out of supplies. We're running out of ways to protect ourselves. So the risk of us healthcare workers getting it is so high, and then spreading it to everyone else. It's just like, we're very nervous.
So you're like probably constantly like nervous and stressed about that, right? I mean,
constantly. Yeah.
And you're seeing
constantly.
people. Yeah, I mean, I'm assuming you've seen people who have it like severely.
Yeah.
Come in. Wow.
Yeah. And they get really sick. I've even seen a lot of young people, like young, otherwise healthy people, who get really sick and have to go to the ICU. And it's like, it's terrifying.
Yeah,
it's terrifying.
I had a friend go in, I think, to like Cedars yesterday. She posted about it. She's really sick. She's got the whole like scary chest, like kind of cough and fever. And they basically said what you said. They're like, well, you're like not bad enough that you need to be admitted. So they just told her, just go home and don't see anyone. And she's like, cool, just be isolated while I feel like I've never felt worse in my life. Great.
Yeah. I know. It's really terrifying.
But it's just sort of this like, nobody knows what to do right now. So everyone's making it up as they go.
Oh, sorry.
No. And then it's like, I don't know if the CDC, it's like, I don't know if this government agency is doing the best they can, or if they're just like, there's so much misinformation. It's hard to tell.
Yeah, and all of their guidelines are just really convenient based on supplies. So it's like, okay, first it's respiratory communication, which means, like, you know, if I like sneeze or cough, it's like in the air. It's in the air and it's airborne, which means that we need to wear N95 masks. And then as we started to run low on N95 masks, they were like, we changed it. It's actually like contact, which just means if you touch something, then you can get it, and it's not respiratory.
Oh, so they're like saying it's not airborne because there's nothing they can do. Oh
yeah,
my
so
God.
As supplies start dwindling, seriously, they changed the protocol. And their most recent recommendation for us is to wear scarves, like bandanas, as
scarves. I
to
heard someone say that, and I thought it was a joke. Like, you mean just like if you're out of masks?
Yeah, and so that's why all of these people, I don't know if you've seen on Facebook, like people are making masks for healthcare workers out of fucking fabric.
Jesus.
I'm like, is this the influenza pandemic of 1919? Like, certainly we can make more N95 masks, right?
Yeah, it's like we must have the supplies.
Like,
it's supposed to be the Wild West in every hospital.
I mean, it's crazy what's happening right now. Like, everything was normal, like, 3.5 weeks ago, you know?
Isn't that crazy how quickly it went to like, just fucking
absolute shit.
That's so crazy.
It's a
trip.
The
fact that they're changing it based on that, instead of just owning it and being like, look, we have a shortage and just fucking be careful. Like,
I know. It makes me feel even less safe.
Oh my God, I just cleared my throat in public, and then I had to like look around like, no, it's just I just woke up.
I know, you can't do anything in public. I saw someone sneezed in the line at Ralph's the other day, and I was like,
I've done that. I have like such bad allergies. Like, I've had them for like 2 months. It's just that time of year for me.
It really
is. I sneezed the other day, and then I immediately was like,
I know. You just feel like everyone around you is like, the music stops.
Like, they're like, get her, but they're not. They're just gonna leave you alone. So I guess that's fine. I don't know. Are you trying to do anything like in your off time for like stress management or anything? Like,
I've been working a lot, and so
has your schedule increased?
No, the schedule hasn't changed, but I was like just scheduled to be working a ton at the end of the month anyways. Okay. And so when I'm not working, I feel like I'm just like talking to people about it, you know, or like frantically like looking at the news. I'm like a little bit. Yesterday, I tried to do a better job of just like taking a little bit of a step back and like not obsessively looking at the news and like chatting with friends via FaceTime and not really talking about it, just because it's like kind of gotten to the point where I'm just super overwhelmed.
Well, yeah, you're surrounded by it. I mean, I can't even imagine. I've been doing that just as someone who, you know, is inundated with news, like any regular person who uses the internet. I was somehow in quarantine or self-isolation or whatever they're fucking calling it, safer at home. I've used my phone less because it's like, I don't want to see the article you're sharing about how this is the end of the world, you know? It's like, okay, well. Yeah.
I mean, honestly, it's like, I think it's gonna eat us alive. We're all sitting at home and like, this is all that we're getting. And it's like, okay, you gotta like take a little time out, do a little home yoga or something.
Absolutely. I'm literally like, I'm doing like yoga with Adrian, the YouTube series, like today. Oh, nice. And me and my friend are like texting each other, like, let's be accountable. And I'm watching way more TV than I ever watch.
I know. Well, if you have any recommendations, let me know, because I need some new shows.
Have you already watched Love is Blind? Because
oh my God. God.
And The Circle, it's like they've been preparing for quarantine this whole time.
I know, right?
Like, they're used to this.
Seriously. The Circle was one of my favorites. I need one of those. I need another show like that. I want to get lost in something like really just mind-numbing and
exactly. Where it's like you don't have to think, you don't have to be invested. It's just like
I don't want it to be like dramatic. Nice. Exactly.
No, I know.
I want it to be dumb.
Yeah, and Andy, like my boyfriend, for the listeners who don't already know that, but I'm sure they do. I've talked about him, but like he started watching this like dramatic ass show and like somebody stole someone's baby, and I was like, why are you watching a soap opera?
I know. He tried to get me to watch.
Fire.
Seriously, he tried to get me to watch Westworld. I watched like the first 10 minutes, and I was like, this is just too much.
Just absolutely not.
I can't do this right now.
Are there people who show up expecting you guys to have like a cure for coronavirus?
No, I think that the media has done a good enough job at this point of informing people like what the disease process is. Although yesterday, I like the only light at the end of this tunnel that I've seen so far is there's a new study coming out from France.
Hydrochloroquine.
Yeah.
And Z-Packs.
Yeah. Two different medications.
Sorry, go ahead.
Oh.
I'm so excited, but like I can't see your face, so I'm like can't take visual cues.
No, sorry. I have like the face for a podcast right now. I was like, I can't do a video. Yeah, so the study only had 30 people in it, but it was incredibly promising. And I saw that yesterday morning, like at 6 a.m., right when I got to work. And it was like, okay, I'm finally feeling so much better about this.
Like there's something hope maybe coming.
Yeah, like
nice.
Literally for the first time, I felt a little bit of hope. And I was just like, oh my gosh, this is so exciting. The only
what a nice
thing
feeling.
is that all the medications are on back order right now, but I think...
Listen, girl, hydrochloroquine is Plaquenil. That's my RA meds. I went off those a year ago. I'm sitting on a stack of it. So you get some Z-Packs.
Really? Yeah.
I've got hydrochloroquine. We'll just make a bunk-ass lab.
Yeah. Oh my God, amazing.
We'll just start selling janky cures. put it in like a face mask that people can put on. Just like rub it on your face. You'll be fine.
We can trade it. We'll have like a new bartering system. Like, I'll give you toilet paper if you give me Plaquenil.
For real. I thought that was so interesting because I saw the initial just like tweet about it and I was like, hydrochloroquine. Wait, that's anti-malarial. That's what they use also for rheumatoid arthritis. But what an interesting combo. I wonder like what other meds they went through, or like maybe they have research. I don't know.
Yeah, they're doing some research. There's another antiviral that's a lot more expensive and is looking a lot less promising. So
interesting.
Yeah, and they actually like one of the theories is the reason that the coronavirus isn't so widespread in Africa is because like basically the entire continent is on Plaquenil for malaria, and same with South America.
Oh, that is such a good point because of malaria. Oh,
yeah, so I mean that's one of the theories, but yeah, I mean it makes sense.
I mean, yeah, truly. But you know, hopefully they'll just.
I'm 1,000 times more hopeful at this point than I was, 2 days ago. Because yesterday driving to work, I was just like so scared. Healthcare work, like 10% of all of the deaths in Italy are healthcare workers.
Oh no.
Yeah, healthcare workers have a much higher mortality rate than the average person, and I'm just like, oh, if I get
because you guys are exposed to it more, but also like exposed to who knows what else. Because there's people coming in who probably have, who have other viruses.
Right.
And like, are there any precautions or like, is there anything being done in hospitals to try to like separate other non-COVID patients from the COVID ones? Or is it just like we're putting people wherever we can?
No. So we're in my ER, we finally got a tent set up outside. And so everyone that we suspect may have COVID, which at this point is basically anyone with a cough and a fever.
Okay.
Or shortness of breath, they go into our tent. So they don't even come inside the hospital. So they're not infecting anyone unless they're really, really, really sick. And then we take them into the hospital, but we have separate rooms for them that are like ventilated in a certain way so that they're not like infecting everyone else. So basically everyone that we just has like a mild case of it just goes into the tent and then goes home.
Oh, wow. It's just sort of like just drink a lot of water.
Seriously, like take some Advil and drink a lot of water and stay away from people. But a lot of people live with like their older parents, and it's like, what are they supposed to do? I have no idea.
Yeah, they're like, I'm trying to take care of this old person, and I know it's scary for like parents or like just thinking about more vulnerable communities. But even they say that, and then you hear about people who, are getting it really bad who you wouldn't think are vulnerable. So it's kind of like, well, fuck.
I know, exactly.
Are there, let me see. Do you feel like there's any common misconceptions about it? Anything that people, maybe like symptoms people have wrong or anything?
I think people understand it for the most part. Like it's 90% of people who have it have a fever. Basically, everyone has a cough. Oftentimes, it starts with a sore throat and then sort of works its way down. A lot of time, people are sick for like 2 weeks and it's really mild. And then all of a sudden, it becomes like severe shortness of breath, fever, that sort of thing. Usually, it's pretty rare to have nausea and vomiting, but it can happen.
Okay.
Yeah, it's pretty rare. Basically, no one has diarrhea with it except for like, I think 4% of people or something. So it's mostly just like the shortness of breath, cough, fever kind of stuff.
And do they think that like this has actually been in the States longer? Sorry, everyone who can hear my dog barking because we're at a park and there's another dog.
Hi, Mookie.
Hi, everyone. Do they think this has been in the States longer than it's been like a situation? Like, do they think it's been here since like November, December?
Probably since late December. It's actually really interesting. They can track the virus because as it is traveling, it's mutating. And so they've actually been able to track the virus back to like the first family who got it in China. And that was it's really crazy. And that was in November. So if they look at that virus, it has like 180 base pairs or something. And every time it mutates and it travels to a new person, 3 of those base pairs change. So they can track it the way back. Yeah. So they have basically a family tree of the virus. So they think that it started in China in like late November. But they didn't start, the one person that came from Wuhan, China to Seattle that had it, there was apparently not another reported case for 6 weeks. And then all of a sudden a whole nursing home got taken out.
Explosion.
Yeah. And so basically what they realized is that it was just spreading like a wildfire throughout the community and they just weren't really testing.
Because they didn't know that's what it was.
Until people started dying. Until people started dying of the same thing. And then they realized that it was all coronavirus. So, it's definitely way more prevalent than we think because we're not testing.
Absolutely. Well, that's what I would ask you about. So you guys, do you have a limited number of tests? Who does get tested?
Yeah. So yesterday, I think we had 100 tests. At the beginning of the day, we had 100 tests left. I don't know how many we have today. I haven't looked at my emails.
Yikes.
But, yeah. So, before, like I said, it keeps changing. And so we were testing people just based on suspicion, a few days ago, the middle of last week. If we felt like we were 100% sure they had it, then we would test them a lot of times and then just send them home, put them in quarantine. But now we can't do that really. Sorry, my dog's trying to eat my food. We're just testing people that are really, really sick and healthcare workers, basically.
Wow. So
yeah.
Oh. No, go ahead.
So, from an epidemiology standpoint, it would be really nice to know how widespread the disease is so we could track it better. And then maybe we can all come out of lockdown when we see it start to trend down. But we just don't even really have those numbers at this point.
Wow. Do you think there's a lot of people think that Trump, which transfers over to the CDC, they don't want the numbers to be out because they're worried about stock market shit?
Maybe.
They want to give an image that it's not as bad as it is?
Yeah, but I think that maybe, but I think what that does is it just makes people more afraid. Yeah. Because you don't know how bad it is. I think when you're a little bit more transparent about what's happening and we get a real mortality estimate, then people have a little bit more peace of mind about what direction things are going in, or I don't know, or maybe they would be more afraid. But right now, our mortality rate in the United States is not terrible. It's
relative to a lot of other places.
Yeah, exactly. It's way better than Italy. So I don't know. Maybe they are trying to hide it. They've definitely got their own agenda and whatever they're doing is not working. But yeah, who knows?
Yeah, I had a friend, this was in Nevada, so I don't know if the rules are different state to state or if you guys are going by a national thing, but she was super sick and the hospital told her, this is like a week or two ago, so maybe that was just what was going on then, they tested her for literally, they were like, we're going to test you for every other possible virus before we test you
Yeah.
for corona.
Yeah,
And
that's
so
what
she
we were
had-
doing.
Okay.
That's
No,
what we
go
were doing
ahead.
like a week and a half ago. We were testing for influenza, RSV, and then doing a chest x-ray. And like if all of that was, because it's pretty rare to have a co-infection with like influenza. And so if like you were
okay.
influenza positive, then we'd be like, okay, you don't have coronavirus. But if all of that is negative, then it's like, well, I don't know, you probably have coronavirus or just a common cold. You should just go home.
Yeah,
Like,
we
we
just
don't know.
go home. That's what I was curious about because they tested her. She ended up having 2 different viruses. I don't even know if they were probably bronchitis or something, or I don't even know if that's a virus, but 2 different things.
It is,
and then
yeah.
they're like, well, you have these, so it's not that. That's what I was curious about. If it's like, couldn't they coexist? But is it not common?
It's really uncommon.
Okay.
Apparently it can happen, but it's incredibly rare to have a co-infection. So we're just like kind of putting our eggs in that basket. And if you have influenza, you probably don't have coronavirus. But
Yeah.
again, we don't really know.
Yeah. Well, you're just doing the best you can. And then celebrities who are getting tested. Is that just rich people like sliding doctors' money? And
I mean, yeah, they have their own personal physicians, and a lot of
that's
times
true.
their tests come back way faster because they have access to the right people.
Because money talks, I guess.
Yeah, it's
God,
just
that's America.
I know it's really frustrating though. Like I had a patient that I tested, and her test didn't come back for like 5 days. And these celebrities are getting their test back in like 2 days. And I'm just like, she's actually like really sick.
And it's all these like
and-
asymptomatic, like Kris Jenner just sitting on her couch.
Exactly. And like, she's fine. And she knows that she doesn't have coronavirus at the moment, you know?
Well, at
And
this
I'm like,
point, it's almost like, are celebrities just trying to stay relevant?
I know.
I
Because
don't
like,
have
if you
it.
leave your house, I know, right? They can like make a post about how they don't have it. And if you leave your house and you touch literally anything, you might get it. So it doesn't even really matter, you know?
Right. Wow. Do you feel like it is like, it's like an airborne thing? I know it's gone back and forth, but is it like
It's both airborne. It can survive in the air up to 3 hours, but it's also contact. So it can survive on stainless steel and plastic for up to 3 days. So say you...
Oh, 3
I know.
days. Okay. I've heard 9 days and I was like, Jesus.
No, that would be crazy. That would be insane. I mean, I think 3 days is crazy. Like, that freaks me out so much. Like, somebody like 3 days ago touches the same door handle that I do, and then I, like, touch my eye or something.
Yeah.
And then I'm sick. Like, that's crazy.
Right. And the face touching. It's like, I didn't know how much I touched my face
Yeah.
until they're like, don't touch your face. And I was like, well, I guess that's the only thing I've ever done my whole life.
I know. I'm actually getting goggles today, so I'm like, do not touch my
God
eyeballs. Like, mask all day. Like, don't. Because it's so hard not to. And I have allergies right now, too. Like, my eye is watering, like, right as we speak. And I'm like, oh, okay.
Oh, God.
It's going to be hard at work.
Oh, my gosh. Yeah. I guess. I'm trying to think this is a weird question. I don't even know if you'd know the answer, but it just popped in my mind because my friend who I just mentioned who went to the ER and got tested for 2 other things or whatever, she's a mom, a new mom. Can viruses be passed through breast milk? Is that a thing?
So no, but antibodies to viruses are passed through breast milk. So if she does have it, it's actually probably like better for her to breastfeed.
Oh, so it's like you're passing on the things that like help.
Yeah,
'Cause you've already built them
protect
up.
you. Yeah,
Wow,
exactly.
okay.
So you're passing on the things that protect you to your baby. But you know,
That's
one
amazing.
thing that's really, really, really amazing and like sort of the saving grace of this virus is that it doesn't hurt kids. So
Yeah. But then they're just like the silent carriers, little
I
like
know they're the ones
booger
that are
monsters
killing
spreading it to
everyone.
grandma.
Exactly. But they're not dying. So, like, I mean, can you imagine, though, if we were, like, just so many sick kids everywhere that were dying? It would be horrible.
Oh, it would be horrifying. So it's like at
It's
least...
not, I mean, it's bad either way, but, like, I'm just really thankful that it's not a ton
at
of
least-
sick and dying kids.
Exactly. At least that's one population that doesn't seem to be really getting affected by it.
Yeah, exactly.
So I just need someone to come breastfeed me for safety, and I'll be good.
I'm sure you can have someone donate their breast milk to you.
That'd be so crazy. Shit. Just wrapping up. Do you have any advice for like anyone? I mean, if you want to just like, second the, self-quarantining, just advice to like try to stay as healthy as possible. Like, what's the best thing people can do? I
mean, honestly, the best thing that anyone can do right now is stay home. Because like we were just talking about, this virus is incredibly contagious.
As I'm walking down the street, I'm like, stay inside, everyone.
It's fine. Like, I was just outside with my dog too, but stay away from people.
Absolutely.
Try to, like, I don't touch any door handle with my hand anymore. I use a sleeve or whatever
Smart.
I have. But stay home as much as possible. Don't have friends over.
Yeah.
Just, like if you have your roommates or your boyfriend or girlfriend or people like that you are close with or that you're living with, and like that's obviously, that's fine, but like try to stay away from people as much as possible. And if you have any extra N95 masks that you don't need, if you have more than you need, please donate them to your local emergency department or somebody that you know that works in healthcare, because we are running out and it's really, really, really scary.
Yes. And people can if someone just showed up to like a hospital and they're like, I just have these masks.
Yeah. Oh my God.
Like, great, cool.
I would literally like burst into tears.
That's amazing. And then
yeah, seriously, it's a really big deal. And everyone everywhere in the world is like dealing with the same shortage. So regardless of where you live, it would be like a really, really, really appreciated donation.
That's incredible. Then if anyone's feeling symptoms, is it just how you would treat the flu? Like you said before, just like Advil and water and rest?
Yeah. Just stay put. And so, if you are feeling symptoms and you do live with people, just kind of like quarantine yourself to your own room, disinfect everything. Don't touch the same things that other people are touching. And, if you're having really bad shortness of breath with a fever, you're having trouble walking across your living room, that sort of thing, then absolutely come to the emergency department. But otherwise, just stay home until more testing becomes available. And we can, in that case, then we can test people. But at this point, we just can't.
Oh, man. Well, thank you for taking time out of your busy, crazy day to talk to us about this. I really appreciate it.
Of course. I'm happy to do it.
Yeah, you guys go give Amber or your local emergency room masks, and we will talk to you soon. Bye, idiots.
Bye.
Well, there you have it. All things emergency room, physician's assistant, coronavirus now from the incredible Amber Janson. Thank you so much to her for taking time out of her crazy schedule and for being out there on the front line, putting herself at risk to help our loved ones, to help us when we get sick. Go donate masks if you have extra masks that you've been hoarding like toilet paper. Maybe some of you are using the masks as toilet paper. Please don't do that. Donate them, like she said, to your nearest medical facility. They are low and they appreciate it. If you like the podcast and you haven't subscribed, would love it if you would hit that subscribe button, rate, review it on iTunes, share the podcast with your friends because everyone's a little bit ignorant sometimes. Big, big thank you to John, Jean, Greg, Kathy, and Terry, exclusive members of the League of Extraordinary Idiots on Patreon. Again, head on over to patreon.com/ignoranceisblessed if you want to get involved there. Get cool postcards. We're going to do Google Hangs, bonus content, you name it. Maybe I'll start doing some videos. Who knows? Follow at Ignorance is Blessed on Instagram to put faces to the voices you hear. And please keep in mind that no guest is or claims to be a representative for every person who has a similar identity. They're just one person sharing their own experience and ideas to help us get a peek at how things look from their situated position in the world. If you have additional questions for Amber or any guest, or you have a topic you'd like covered, something specific you want to hear about, someone specific you want me to interview for that topic, let me know at JMS Comedy all over the internet or post it right in the Facebook group. Just look up Ignorance is #blessed idiots and you can post right there. I stay as involved as I can there, which is a lot nowadays. So just jump in there and keep giving suggestions, keep asking questions, because the more we ask, the more we learn, the more we know. And the more we know, the more we can look down on others who aren't as smart as we are. And isn't that the point? Thank you for listening and thank you for being patient with my ignorance. Stay healthy out there, idiots.